Objectives: define violence in the healthcare workplace. Who is at risk? Recognize risk factors. Effects of workplace violence. Knowledge of prevention strategies. What to do. Behaviors in the work setting that cause physical or emotional harm or physical assault, emotional or verbal abuse, threatening, harassing, or coercive behavior. Most ER nurses that I know have been spit on, bitten, slapped, and some have even been bit and hit. More than 18 million healthcare workers today are at risk to experience workplace violence. 80% are women. Of all non-fatal and violent acts that occurred in the workplace, approximately 60% occurred in healthcare and social assistance industries. Healthcare settings most at risk are emergency departments, psychiatric units, patient rooms, waiting rooms, home health, parking lots of facilities, and large urban areas. Lack of violence prevention programs, low staffing levels, lack of effective staff training, inadequate security in facilities, psychotic patients, patients with drug alcohol addictions, long waits for services, and working alone. Factors that increase emotional tension: patients in pain, patients and visitors dealing with fear of their condition, anger directed at the hospital or healthcare system, cramped physical space, long wait times, and disapproval of the medical care they're being treated.
Direct effects of violence is minor or major physical injuries, temporary or permanent physical disabilities, psychological trauma, and death. Indirect effects of workplace violence consist of low worker morale, increase in job stress, increase in employee turnover, reduced trust of management and coworkers, and a hostile work environment. Some preventive strategies consist of environmental design, such as security systems, security guards, and appropriate lighting in parking lots. Also administrative controls, such as protocols that are in place at each facility, and having zero tolerance. Also educating staff with tools to diffuse situations, which include ongoing teaching tools, and it's important to report the incidents when they occur. Engineering strategies consist of emergency alarms, signaling and monitoring systems, security devices such as medical detectors and cameras, enclosed nurses stations, and bulletproof glass enclosures at reception areas. One problem with this is sometimes a financial issue with the facility, so they may not be able to provide these strategies. Safety tips for healthcare employees is watching for signs of violence, creating a buddy system, maintaining behavior that can diffuse the situation, staying alert, having an escape plan, and always keeping an open path for exiting the room. Signals of impending violence is verbally expressed anger or frustration from the patient or family member. You have to watch for their body language of anger and frustration, signs of drug or alcohol use, and presence of a weapon. Some behaviors to diffuse the anger can be by you presenting a calm, caring attitude, not getting angry back with them and not matching their threats, not taking care of them by giving orders, and acknowledging the person's feelings, and avoiding behavior that may be interpreted as aggressive. If you're unable to diffuse, you need to remove yourself from the situation, call security for help, and report any violent situations to management.